Hi, I'm Dr. Beltre from Beltre Bariatrics, and today I'm going to talk about common questions that patients ask me. I try to make videos that concern my patients and the questions that I get asked. One of the questions that I get asked a lot is about hair loss after weight loss surgery. Yes, hair loss can occur. I will say that the hair loss occurs in about 40% of my female patients, and it normally occurs during the first 4 to 6 months after any weight loss procedure. It is a common concern for many individuals. This is a phenomenon that it's referred to as telogen effluvium. Telogen effluvium is a type of temporary hair loss that occurs when the body undergoes a significant physiological stress, such as a major surgery, extreme weight loss, or significant dietary changes. And of course, these are three things that you see in weight loss surgery: stress from the surgery, changes in dietary habits, and a physiological stressor. So therefore, hair loss after weight loss surgery can and it does happen. There are several contributing factors to hair loss after bariatric surgery that I just hinted on. Number one, nutritional deficiency. So bariatric surgery, like the gastric bypass, gastric sleeve, duodenal switch, and of course, leads to reduced consumption of nutrients and reduced absorption of nutrients in some of the procedures. And this changing absorption can lead to vitamins deficiency, minerals that are essential for healthy hair growth. Some of these minerals that aid in hair growth and can therefore be affected with obesity surgery include iron, zinc, biotin, and protein. So changing nutrition can lead to hair loss. Another stressor that can lead to hair loss is a rapid weight loss. Significant and rapid weight loss can shock the body, disrupt the normal hair growth cycle, and this cycle can be interrupted by this rapid weight loss. This can push more hair follicles into the resting phase, right? So there's a resting phase, and then there's growth phase with the hair, and this stressor can make it where the hair follicle stays in the resting phase, and therefore they don't grow back, and this leads to increased shedding of hair. Changes in hormones, right? Bariatric surgery is a metabolic procedure. It changes your hormonal components, and therefore, since bariatric surgery can affect hormone levels in the body, including those hormones that influence hair growth. So therefore, it's going to affect how your hair grows, and it can sometimes lead to hair loss. So therefore, these fluctuations in hormones level can contribute to hair loss. Stress, like I mentioned before, right? Undergoing major surgery, adjusting to significant lifestyle changes can be emotionally and physically and physiologically, I would say, stressful. Therefore, stress is known to contribute to hair loss. Gender, males tend to do better than females in terms of hair loss after weight loss surgery, and it may have to do with what I just mentioned, hormones, but also I believe the length of the hair has a lot to do. Males tend to generally wear more shorter hair than females. Longer hair, of course, weighs more stressful, more energy to maintain because it's much longer, and therefore you tend to see more falling of hair in female patients compared to male patients. Well, while hair loss after bariatric surgery can be distressing, it is often temporary. So I want people to understand that it's temporary, and many people experience regrowth within a year or so after the bariatric surgery. However, there are things that you can do. There are steps that individuals can take to minimize hair loss and support healthy regrowth. Number one, follow your nutritional guidelines. You just have bariatric surgery. As you know, you met with a nutritionist. Very, very important that you adhere to nutritional guidelines that were provided by your healthcare team after bariatric surgery. This typically involves taking prescribed supplements like your multivitamins to prevent deficiency. So taking your multivitamin is very, very important. Ensure adequate protein intake. Hair is an extension of your skin. Hair, it grows out of our skin. So therefore, what affects our skin also affects our hair. So protein intake is also very important for appropriate hair growth. And therefore, it's important to consume enough protein-rich food in addition to your supplements for healthy hair growth. Stay hydrated. So drinking plenty of fluids after your surgery is very important. So make sure you stay well hydrated. This is also essential for the health of your hair as well as your skin. And yeah, it specifically affects your hair follicles, which needs to remain healthy for the hair cycle growth to begin. In addition to your multivitamins that I mentioned, I always tell my patient taking biotin in addition to your bariatric multivitamins is very important. You can take biotin. There's one specifically that I recommend called Viviscal. Biotin can also promote the new hair growth as well. And this has been recommended by patients of mine that have taken it with excellent results. And since then, I've recommended myself and patients do really well. And finally, be patient. Hair loss after bariatric surgery is usually temporary. It can take time for a hair to regrow fully. But most patients will see improvement within a year. So be patient, take good care of yourself, take your multivitamins, exercise, eat healthy, take enough protein. And if you're experiencing significant or prolonged hair loss after bariatric surgery, it's essential to discuss this with your healthcare provider. They can evaluate you. We can check for your nutritional status, your hormone levels, and the overall health to determine if there's anything additional that can be done to treat the hair loss. So again, I'm Dr. Beltre from Beltre Bariatrics. I hope this video was informational to you, and remember, there are things that you can do to help not only prevent but reduce hair loss and help with regrowth. Take care of the stress through exercising, through counseling, mindfulness. Eat healthy, take enough proteins, take your multivitamins, including biotin. Again, Dr. Beltre from Beltre Bariatrics, and thank you for listening.